so here we go. So you want to click over to the first slide there. So the background. Next slide. Perfect. So this is the fun part where I get to talk a little bit about the lab. So we're an independent not-for-profit organization. We've been around for about 80 years, and our focus is really in genetics and genomics. And we're really looking to identify precision or specific genetic and genomic cures for disease. That's really the mission statement and the goal of the organization. We are interested in the fact that the organization is really split in two kind of disparate employee groups. We've got half of our business is really kind of what we call the mouse business. So we're raising these mouse models, and it's very much a production environment. So for those of you that might work in places where you have a lot of productivity type work taking place, in a manufacturing environment, that type of stuff, we have that. And then the other side is really the scientists, the research, and it's got more of an academic feel. So hopefully that gives you a little sense of what the laboratory is about. And this slide indicates our population distribution. So we're about 1,800 employees and growing. The average age is 42, but we've got very disparate, again, demographics when you look across the spectrum of our employee base. 74% of our folks are in Maine, and they fall just slightly above that average of about 43 for average age. For the other two groups, we are in California, quite a ways below that, so much younger demographic there, and then in Connecticut, a little bit above that, so below and above the average depending on location. And we're about evenly split, male and female. So we launched Jack's Fit in 27 as a comprehensive wellness program. I will tell you it was really probably not that in 2007. This has really been an evolution, an evolutionary process that has taken place that's really brought us to where we are today as we've implemented different programs, tested different programs, evaluated different programs associated with our wellness and our health and welfare plan. Our employees currently can earn up to $1,300 as an individual or $2,600 as a family. In practice, that rarely ever happens. For the most part, employees get very close to paying down most of their deductible, which today, is $500 for a single, $800 for family, and so those deductibles get paid almost to zero in most cases, and certainly the opportunity exists for that to take place. We are really focused on driving reduction in health risk factors. So if you think about a risk pool, and you think about it in three buckets, you've got that high-end bucket, which is really that chronic disease bucket, more severe kind of medical conditions, and you've got that medical bucket that is got some of the acute type of stuff in it, but it's really, again, more of that not chronic disease, but risk factors indicating that there could be. And then, of course, you've got the bucket that would really traditionally be way to the left on that graph, which is kind of your healthy people. And the idea is really, well, we'd like to put everybody in the healthy bucket. That's not practical because of decisions people make and other things. So you really try to push, that graphic so that you have the most people in the healthy bucket, maybe a few extra, few other people in that middle bucket, and as few people as possible kind of in that high-end bucket. And this is a kind of a good graphic here under medical costs that describe kind of what I was just commenting on. So you can see medical claims for chronic condition management, and you can see in 2012, it made up about 40%, right? Of the medical costs, and then in 13 you see a big spike, and then in 14 we started driving that down, and we'll talk a little bit about today about how NutriSavings is going to help us do that. Again, on the right side of this graphic is the top chronic conditions and how they drive cost. So these will look undoubtedly familiar to all of you that are familiar with health plans, or even just your employee base, or even if you think about Maine as a whole and kind of where there are risk factors and conditions that significantly impact cost. These are all them, and we hear about them in the press as well. So you've got your asthma, depression-related disorder, so that's that behavioral health piece, obesity, diabetes, coronary heart disease, and high blood pressure. And you can see over the years kind of what's happened. We've had an increase in asthma, certainly an increase, or we've maintained the depression-related disorders, and increases in obesity or diabetes. So we're either holding the line or seeing increases in a lot of these once you kind of remove that spike for high blood pressure. So those are the things we're facing at this point. Go to the next slide. And here are the risk factors. So these are the underlying risk factors based on our claims data that show kind of where our employee population fell. And I will say fell because I think we have made some progress, certainly since we've implemented NutriSavings and other programs in 2015, and I think we've carried some of that momentum forward into 16. But for the years identified here, 2012, 13, and 14, you can see poor nutrition really makes up a high percentage of that underlying risk factors. Now, for years, many of you have probably heard this in the press, right? We were told by the FDA and the government and anybody that will listen, we don't exercise enough. That's really, the issue we have, and that's why we're seeing this obesity, skyrocket the way it has. And what we've come to find out, both in the claims data as well as in a lot of the medical literature, is that's just not true. You can exercise 10 days a week and 26 hours a day, but at the end of the day, you can't out-exercise a poor diet. And I think there's starting to be much more recognition of that. And again, with our wellness program and our health program, we really wanted to focus on prevention and how we could help our employees be healthier. Certainly there's a cost savings associated with that, but I think there's a much more altruistic goal of just having our employees be as healthy as they can be. And you can't do that, smoking, not being active, drinking too much alcohol, and certainly you can't do that when you eat a poor diet. And we know from the medical literature that a plant-based diet is a big driver, and there's been lots of longitudinal studies done that prove that a plant-based diet, assuming all other factors are held equal, really does have a significant impact on individual health. So we wanted to go after that. Next slide. All right, so how do you address it? And so the first kind of block you see there on the graphic is, right, how do you address the confusion, right? So what, is better, a bag of chips, or an apple, kind of thing. And it's sorting through all the maze of information that comes at consumers and ultimately our employees. And so we use a scoring system, right, for all food items on a scoring range of 0 to 100. This is similar to kind of what you see with guiding stars and some of these other things. It actually scores different food. Obviously, the lower in the scoring range, the poorer nutrition. So again, what you see a lot today, for all those of you that consume groceries, and I'll assume that's everybody for purposes of this argument, is a lot of processed food, a wide variety of that, and it typically you'll notice that it is really calorie dense but nutrition deficient. And so really what we want to try to do is push our employees to a place where that paradigm is beginning to change. So hopefully that makes sense to everybody. Tracking purchases is also part of this. So what NutriSavings does is it links to a local grocer. So in our case here in Maine, everyone will be familiar with Hannaford and Shaw's. A large proportion of our employees, as well as just the general public, shop at these grocers. And so what we ended up doing is NutriSavings, we got these little barcodes, and in my case, I actually stuck it on the back of my cell phone. So when I did my grocery shopping, once I got signed up for the program, I came in and I bought my groceries, and they scanned those, and then they just scanned the barcode on the back of my phone, and that captured basically what was in my shopping cart. And so it was able to identify how much produce, how much potato chips I bought, how much all that stuff is, and so we were able to track that. And it's automatic, and once you're signed up, it is really very easy. I've been using it for a while now. I've been quite happy with it. And of course, you get more credit for better food. So if I buy a lot more produce, then I get higher points, and those points actually turn into dollars. And so are motivated because what actually, I think her name is Samantha that works with Neeraj, who we're going to invite in here in a minute. She does NutriSavings as well, and what she did is she would save her points and the cash that goes along with that throughout the year, and then at the end of the year, around Christmas time or whenever, she might have $300 worth of points in there that she could then use, to do a Christmas shopping, for example, or grocery shopping for Christmas or Thanksgiving or whatever. So, and there are lots of different ways our employees have utilized it and handled it, but it's worked quite well, I think, in that regard. And then ultimately what you're really trying to do is behavior change, and Neeraj and I have started to have some really detailed conversations around data on this point, but what really I want to see as a plan sponsor is I want to see the employees that typically would not eat as healthy. You like to see how that changes over time, right? So we track the scores over time and say, for employee A that used to buy, a lot of processed food, chips, TV dinners, all that type of stuff, and that was 50% of their basket. We like to see that maybe down to 10, and that doesn't happen overnight, but we're able to track and measure that and say, is there really an impact by offering this program and the incentives that come with it, and does that really change behavior, which is really ultimately what we're looking to do.
I think, Paul, you made an excellent point in here. There is one more area that I think we believe very strongly is many times sharing the facts with the consumers has a profound impact on how they see things. They start seeing things differently. Just like when we have Fitbit device given to people, people start walking more. When they start seeing their healthy score, they start making a conscious attempt to start buying healthier food over a long period as well. Can you advance the slide? So the way the Healthy Food Program got launched was in partnership with the JAXFIT team, which was a combination of several levels of communication that was triggered to members. The first and foremost was sending out personalized emails to all the JAX employees, educating them about the benefit of the program, and JAX team also sent out mailers to employees' home address. And the mailers were primarily designed towards addressing the employee and their family, because many times the employee may not be the primary shopper, and so it was very important to include the family in the overall wellness endeavor. And then we had on-site posters and table tents which were posted in many high traffic zones, like we had at almost all the entrances, if I remember correctly. We had in the gym area, we had all the conference room having table tents in there, so again to create employee awareness in there. And last but not the least, we were very fortunate to have some employees raising their hands to be a part of video testimonial campaign. And those testimonials became very powerful because when we have co-workers hearing stories of change from their co-workers, that becomes very powerful than just getting an email or just getting a mailer sent to their home address. So these 4 or 5 aspects of communication really played out very well. And it was supplemented with the on-site enrollment sessions that were conducted with partnership with the Jackson Labs and NutriSavings team. And to encourage people to participate in these enrollment events, there were incentives that were given out. And Tom, you want to talk about the passport program a little bit so people have better context of that as well?
Fine. I don't see, it says that he's offline.
So Tom is offline? Okay. So Jackson Labs also had a program called the Passport Program, where the employees are given an actual passport, and there are multiple stamping stations that the employees can go to, just like you go in a conference setting. And the employees were encouraged to come to visit NutriSavings for the onset enrollment sessions, and we were actually stamping their passports. And this passport stamping was giving them some points that they can earn rewards after the enrollment sessions were complete. Can you advance to the next slide, please? Perfect. Next slide as well. So all of these things that we are talking about are possible only if the staff is ready to embrace change. And if the staff is not ready to embrace change, we can try to do push communication, but can only go so far. So that's what laid the foundation for staff awareness and staff readiness. So using their HRA, they were able to identify that a vast majority of people, number one, were aware of the risks that they were facing on a day-to-day basis. So people were aware of that they want to reduce their body weight. There was a very strong awareness for that, and as well as awareness for blood pressure and cholesterol. So awareness is the first step of changing behavior. Can you go next slide, please? And then goes back to the next part of it. So once people became aware, based on the HRA data, when we looked at the percentage of people who were actually looking for a behavior change, we are seeing a big percentage, like 60% people, open to the idea of losing their weight. Now what they're looking for is just the right tool, the right guidance, so that can support them in their journey of weight loss. Similarly, 40% people were trying to reduce their cholesterol intake or reduce fat or reduce their cholesterol level. And that goes back into the prior fact that Tom mentioned, that many times these people have desire to change behavior. It's just the confusion of what exactly is healthy. What should I be eating? I don't have time to go take a time off and go and visit a dietitian. So this readiness became very important, and the NutriSavings came just at the right time to provide a guidance to employees who were willing to change anyways. Can you go next slide? So as we rolled out NutriSavings, we are talking about results. So results for any wellness program fall in multiple buckets. The first and foremost result that any employer would like to look at is to create a meaningful participation. Because if you are not able to create a meaningful participation, you cannot really have the biggest impact from any wellness program. The second part of the results that any employer would rightfully look at is, once we have achieved the meaningful participation, are the employees engaged on a regular basis? So we'll talk about that as well. And lastly, what are the outcomes that we are seeing? So these are the three areas we are going to cover in the results section. Can you go to the next slide, please? So first, as I mentioned, we are talking about participation. So what you're seeing here, main employees really embraced NutriSavings from the day it was launched. On a national level, there were multiple surveys that are being done that a traditional wellness program usually gets between 8 to 12% participation over a 12-month period. And what we saw was the participation just at onset enrollment event in March, we were able to achieve 25% participation rate, which is double than the national average. And over the last several months, we have grown to around 41% participation. Now, there are few factors which are driving this participation. First and foremost was the JackSwitch program in place created a sense of awareness and a desire among employees to change. That was the one driver. The second driver is the fact that nutrition in itself has a very universal appeal to the entire employee population. When we're talking of a challenge like active walking or going to the gym, not everybody can relate to that. If I'm a person who will not go to gym, no matter how much money you throw at me, I will not go to gym. I don't like that. But we all like to eat. And that's a common thread that binds us together. So that's the second lever that played really well with the participation rate going up. The third lever that played really well in the participation going up was the partnership with the local grocery stores. I think more and more as we are working with clients, we are realizing that in HR team, when they're trying to do population health management, if they try to do all by themselves, they can only have so much an effect. So involving the local stakeholders in the local community becomes very important. So in this example, we had actual signage in the in-store in Hannaford. So imagine a Jackson Lab employee going to a grocery shop at Hannaford and the cashier at the checkout is saying, hey, just remember to scan your Hannaford card. So that's a nudge from an unknown person coming in just to remind you on those things. That again became a very important factor for people to participate and have a very positive vibe about the program. Can you go to the next slide, please? Connecticut displayed a remarkable resilience. As you can see, they were all doing all self-enrollment. We did not go on site till October. So from March till October, all they were getting was on digital communication and postal mail directly sent to their home address. So what you're seeing as 25% participation rate over the last 5-6 months have been all driven by employee resilience. All self-service, they signed up, went to the local grocery store and started participating in the program. When we scheduled an on-site event in October, that's where we got an additional bump in there, as you can see in the curve going up. So these are the few factors that we feel have played significant role in creating a very high participation rate. Next slide, please. So once, as I mentioned before, once we have employees participating in the program, the second challenge is how to keep them engaged. And engaged, as we are talking about our own health and well-being, we need to engage people almost on a weekly basis because we are all busy in our day-to-day lives. Anything which is out of sight is out of mind. So the way we track the engagement rates was by tracking are employees remembering to scan their grocery rewards card while checking out. Because the more you remember, that means you have a subconscious mind reminding you, hey, if you scan your grocery rewards card, you will get an email from NutriSavings telling you about the score of your shopping basket. So that's something people look forward to. And as you can see, the number of shopping trips per month per member went up from around 3 trips a month to around 4 trips a month. So if we just do the math, that means people are actually engaging with NutriSavings actively at least once a week, if not more than that. And that becomes a very powerful mechanism for an employer to measure engagement of their employees, for an employee to see value in the overall program that they can relate to. And many times, some of these trips are done by their own family members. It could not be even done by their own employees. So you are not only engaging the employee, but the entire family. Next slide, please. So now we have talked about participation rates and engagement. Let's talk a little bit about outcomes. Next slide, please. Next. So as you have seen in Tom's slide a few minutes ago, there were 5 biggest cost drivers, which were the chronic conditions. So we are going to focus on the top 3 chronic conditions. Can you do next as well? Do next, one more. Thank you. So if you look at the top 3 cost drivers were hypertension, heart diseases, and diabetes. Now, we all can lead an active lifestyle, as you heard Tom directly, but unless we control what goes inside our bodies, you really cannot really control these conditions very effectively. So based on the academic research, for any hypertensive population, the first and foremost thing is they need to control their sodium intake, and they need to start eating more fresh fruits and vegetables. For heart disease, sodium as well as cholesterol intake has to be controlled. For diabetes, if you control your dietary fiber intake, that reduces your overall sugar, the blood glucose level increase because consumption of sugar takes over a longer period of time. So these are the key components we are trying to focus on to see, can we create some dietary behavior changes among the employee population that we can see some meaningful outcomes for these 3 conditions, which are the key cost drivers for Jackson Labs. Next slide, please. So as you saw, the common denominator across all these 3 conditions was to increase consumption of fresh fruits and vegetables. So what you're seeing in the graph here, next please. Thank you. So what you're seeing here is the number of employees and their grocery purchasing patterns. And this graph is specifically showing you how much of produce were employees purchasing. So if you see in March 2015, around 8% of their shopping basket was having a component of fresh fruits and vegetables. And that went up to close to 22% in January, just under 10 months of time. This is 15 points increase in just 10 months of time. So as we mentioned before, we are all adults. Many times we have shown a desire to change. That's exactly what we saw in the HRA results. Now we were looking for tools to help us change, and we are looking for nudging in a positive fashion, a positive reinforcement, so that we can sustain the behavior change as well. So this really beautifully depicts the behavior change that we have seen among the Jackson Labs population. Next slide, please. So while we have seen the produce consumption go up, we were also focused on educating employees in terms of controlling their sodium intake, because we have seen it has a lot of impacts on their outcomes. So what you're seeing on the yellow dotted line are the USDA recommended daily intake requirements. So Jackson Lab employees are consuming a lot more sodium than what they should have, and I think all of us do in reality. But because we were showing them nutritional score of all the food items, they were getting emails after every shopping trip, educating them what their shopping score was. Employees are also getting educated about healthier alternatives that they can swap out for the next shopping trip. What we are seeing is a consistent drop in the sheer amount of sodium intake that we're seeing month after month. Next slide. Similarly, we were trying to encourage people to increase the dietary fiber. And dietary fiber actually helps in your sugar absorption over a longer period of time, so your blood glucose will not shoot up very quickly. And usually, if you start consuming more fruits and vegetables, your dietary fiber should go up. And that's exactly what we're seeing as a pattern, that it is going up month after month, and they are doing a very good job of keeping it up as well. Next slide. And lastly, we wanted to help Jackson employees control cholesterol. Now, all the three slides we have seen so far in terms of dietary fiber or cholesterol or sodium, these are all on nutrition fact panel. But the challenge is, number one, people don't have time to read nutrition fact panel. Number two, they are very hard to understand, very cryptic the way they are described. So that's where NutriSavings score comes into picture, where the employees are usually guided to the process of, if the score is higher, it's a healthier item for you. So if I bought a bag of chips that score 10 today, I cannot really go to 100 score tomorrow. My only goal is, from a NutriSavings standpoint, is to nudge that employee to, rather than eating a bag of chips if it scores 10, move from 10 to 15 scoring bag of chips. Once they have sustained that behavior, then move them from 15 to 20 scoring chips. So that's a gradual progression of behavior change that the employees can sustain over the longer haul. So cholesterol, again, they are doing a wonderful job. They are already below the daily recommended intake level, but they are still controlling it very wonderfully. So we go to the next slide. I'm going to talk about what does that mean from an outcome standpoint. So we're going to talk about the blood glucose risk distribution first. So in 2014, before NutriSavings got rolled out, based on the biometric, on-site biometric results, 78% of the population was having their glucose within the normal limits, and 20% population was in the pre-diabetic limit of their blood glucose level. So just 10 months post a NutriSavings rollout, and there was another biometric done in 2015. Next, please. Thank you. So what you're seeing is that the 7% of the pre-diabetic population was having their blood glucose level contained and controlled within the normal limits. And this is largely influenced by what they were eating, as you have seen in the previous slides. They were having increase in produce consumption. They were having increase in consumption of their dietary fiber. They were able to control their sodium intake as well. Next slide, please. Next. Thank you. Similarly, we were also tracking the cholesterol risk distribution because that also is a cause of many of the diseases. And as you can see, we had a 1% change between 2014 and 2015, where the population was in the optimal level or the suboptimal level. Again, NutriSavings is one of the drivers, but I'm sure people were doing some other physical activities and other things as well. But nutrition component really drove home the message to employees of eating healthy, and we are seeing the results here. Next, please. So lastly, what we are talking of is overall risk for the entire Jackson Labs population. Based on the HRA data, which was we were comparing the results. So in 2013 and 14, 82% of Jackson Labs employee population was given a low risk, which means having 0 to 1 risk factor associated with them. So if an employer wants to control costs, we want to have a lot more employees in the green spectrum rather than the red spectrum. And what we're seeing is just a year down the road, that number has done significantly better. We have about 4% increase in the population which is having a lot more risk control, thanks to their control of glucose and their cholesterol levels. At the same time, we were able to make an impact on the high risk population as well. Again, that's a behavior change that we have seen so far, only in the first year of operation, and that gives us a hope for the long haul. But we need to keep on monitoring these things to make sure nobody falls off the radar and they can continue with this behavior change over the long haul. I think that's it, and we can open it up for questions if anyone has any questions. Maria, are there any questions from audience?
Okay, can you hear me now?
Yes, we can hear you. We hear a strong echo, but we can hear you. Hello?
Okay, so anyway, I'm going to cover some business that we missed in the beginning. So if you want to type your questions in the chat box, then we can go ahead and relay those right now. And then at the end, there'll be a survey if you can please participate in that. And also there is a handout attached to this that you can download for information as well. So the first question is, what drove the level of participation at the Jackson Labs at 4 times higher than the national average?
That's a great question. There are a few things. Can you put yourself in mute, because I think I'm getting an echo. Unmute yourself. Thank you. So the key driver that drove participation was, first and foremost, is the universal appeal of eating. We all love to eat at least 3 times a day, if not more. And that became a tool for us to guide us in eating. And second factor that became really important was engaging the entire family. Because usually what we have seen in general, population-wise, female audiences are a lot more open to the idea of participating in a wellness program than male audiences. And so given that insight, what worked really well in this case was addressing the entire family. So that create again an environment where entire family is participating in healthy eating programs through NutriSavings. I think these two factors really drove home in terms of creating a meaningful participation which is far more than a national average.
Okay, great. Also wondering, can you tell us, since Tom isn't here, Neeraj, can you tell us a little bit about the Jackson Lab population? Like, what's their education level? What are their demographics, so people can kind of get a handle on how their employee populations might compare?
Sure, I would love to. So Jackson Lab's population is all over the spectrum. I mean, they have got, as Tom mentioned earlier on, they had manufacturing or a production floor which comprised primarily of very lower end education, maybe on the high school, not even a graduate level education in there. So on the lower end of the spectrum, to the highest end of the spectrum where we have got postdoctorate fellows doing all the advanced genome research. This is the entire spectrum that we are seeing that were fully engaged in the program. So if you as an employer, you have got population which is more on the lower end of the competition, what we have seen, the motivation for the population is a little bit different than the other spectrum. So usually if you have got a large call center or a manufacturing plant, they want to eat healthy, but affordability is a big concern for them. And NutriSavings, in the partnership with the local grocery stores, we provide rewards and incentives on top of your employer provided rewards and incentives. So those rewards and incentives really make healthy grocery shopping a lot more affordable. That's a lot more easier for employees on the lower end of the competition spectrum to relate to and embrace that change. Whereas on the other end of the spectrum, where you're talking of highly competitive employees, they are getting a lot more education, so they may not really be interested in being driven by incentive money, but they are more driven by a tool that is very personalized to them, that educates and guides them with every shopping trip that they make on what they can do to start living a healthier lifestyle. I think there's a wide spectrum, and that appeals to both the audiences. One audience is more money-driven, other audience may be more health and wellness-driven.
Thank you. Okay. So when something is new and novel, people are interested and they're motivated, but can you speak to a little bit how organizations and plan sponsors have been able to sustain engagement and excitement in the program?
Absolutely. I think that's a great question. So sustaining engagement, as you can all imagine, is a challenge because all of us live in a day and age where our attention span is very limited. We see a new news, we flip our mind, we flip the news channel. That's a very common behavior that all of us display on a day-to-day basis. So what becomes very important is how do we change the scenery of the message? How do we change the frequency of the message? How do we change what is the right time when the employees will be more open to the idea of receiving feedback? So what we have seen work really effectively is a traditional wellness program, the communication to employees is done by only the HR or the wellness committee in the organization. And that goes a certain level of engagement. What we are doing is we are taking that same concept and working with the local grocery store, and them nudging you and your employees at checkout becomes very powerful message that people can relate to. The next aspect of that is for employees to share their own stories, to create challenges and concepts where you can hear success stories for employees. So all these things become really an awareness building environment for employees to sustain engagement. Now is a matter of how can we remove the friction points for employees to hop on the bandwagon and sustain the engagement. And that comes with the fact of our frequency of eating. As we eat at least 3 times a day, and becomes very easy thing that people can relate to, and its universal appeal again creates an engagement model that is sustained over the last 10 months of time so far.
I see. Okay. What about the culture at organizations? Can you share with us maybe some stories of how employees have influenced each other using the program, maybe both? I'm assuming mostly it's been positive, but I wonder if there's also any stories of, where people have affected each other in a way that sort of disincentivized them. I would doubt that be the case, but
Yep.
how can you speak to the cultural shift between peers influencing each other?
Sure. No, I think that's a great question, and culture plays a significant role in employees' desire to embrace a program. So there are several factors that we have learned with Jackson Labs and other implementation with clients. There are certain section of audience who are ready to make a change, and they are looking for the right tools to make a change. And there is a certain segment of employees who may be skeptics, and there is a usual perception in certain segment of employees, hey, I don't want Big Brother watching what I'm eating, and the privacy becomes a concern. So that need to be addressed. I'll talk about how we address that. And third aspect of the program is not everybody wants to embrace it on day one. They're on the fence. They know it is interesting and meaningful for them, but they're on the fence and waiting for someone else to try out before they jump on the bandwagon. So the way we have addressed that with Jackson Labs and the way we address it with many other clients, I'll talk about both of those scenarios. The first and foremost are the employees who are ready to embrace. So they are your early adopters. So post Jackson Labs, we learned some valuable lessons in terms of how can we identify these population of employees which are having a potential to be early adopters. Now what we do is for every client rollout, we do a survey prior to the rollout. And that survey gives us a very good indication of people who are in the contemplation phase of looking to change their behavior. So these are your early adopters that you can identify very easily based on the survey responses the employees give. The second aspect of the program is, which is the privacy part of it. So it's very important, any kind of communication that goes out to employees, and not even once, but maybe more than once, that needs to go out to employees, needs to address the privacy concerns. Any shopping data, any foods that your employees buy is viewable only by the employees, period. Your employer, your health plan would never know, and they have no business to know what your employees are buying. So that has to be addressed with the employees upfront, so they don't have the uncomfortable feeling of a big brother watching them. And the third aspect of it is where people were looking for a change, but they are not sure, they're sitting on the fence. And again, the initial survey gives us some behavioral insight in that segment of population. And that's where we get the avenue of NutriSavings ambassadors, where ambassadors come in and are open to sharing their stories, what they have learned, open to sharing their stories of how it has helped them. And those stories, again, create a network of people where anybody who has not joined so far, now they're saying, okay, if John Smith can do it, so can I. If Paul can do it, so can I.